Good morning, everybody. I'm Dr. Rajendra Bajwa. I'm an infectious disease physician. I work at Niagara Falls Memorial Medical Center. I'm here with Mark Laurrie, who is Superintendent of Niagara Falls School District. I'm primarily here as a parent of a 10-year-old kid, and my son goes to school. Before schools reopened, we all had so many anxieties, so many questions. And to answer those questions, Mark Laurrie, the superintendent, have very graciously accepted our offer to interview him. So before we go into and start asking Mark Laurrie questions about safe reopening of schools in Niagara Falls School District, I would like to put your attention to this graphic on your screens. So this is basically the indicators which CDC have come up, which will help us to say if schools are safe to reopen and how safe they are. So if we see at this slide, so there are core indicators, and first and second core indicator is number of new cases per 100,000 persons within last 14 days, and second number is a percentage of PCR tests which come positive in last 14 days in any given community. So these are the numbers which school district cannot change, and if you go from right to left, you will see those shades of green which change into yellow, orange, and red. So as long as these numbers are on the lower side, schools are relatively safe. Next, we go to core indicators which school district have some control, and as parents, we are going to be responsible that we are also following these core indicators so that schools are safe. And the number one mitigation strategy is consistent and correct use of face mask. Number next is social distancing to the largest extent possible. Next is hand hygiene and respiratory etiquettes. Next is cleaning and disinfection. And last one in this mitigation strategies is contact tracing in collaboration with local health department. So I would say that these five mitigation strategies are some things which the schools and us parents and our children have to follow to keep our schools safely open. So moving on to Mark Laurrie. So I have a question. So I went to the Niagara Falls website, and there's a wonderful piece of guidance which is more than 20 pages long and a lot of information on it. So what we're going to do today is just go step by step and try to understand that information for the parents and our staff members. So we'll start with, could you just tell me how many students do you have in Niagara Falls School District?
Sure. Before I do that, Doctor, I just want to say thank you to you and to Niagara Falls Memorial Medical Center. They have been a true partner in the most trying times and when we needed them the most. And I just wanted to, on behalf of the faculty, staff, 7,200 students, the parents, the 1,200 staff members, I want to thank Niagara Falls Memorial as being our anchor, a partner. And you in particular, with your tireless work and guidance to the staff at Memorial and to us, your accessibility has been nothing but extraordinary. So thank you very much, Doctor.
I appreciate that, and that number is amazing. That's a lot of students, staff, faculty, and families. So you must be working 24 hours and like 7 days a week for past 5 months to prepare for this school reopening. Could you just tell us what kind of safety measures have you implemented in your schools?
Sure, and as you know, being a doctor, it's always being part of a team. You don't just go in there and do something by yourself. And we have a terrific team here in the school district and great external partners like yourself and the Niagara County Health Department. We were talking about them before we came on air. So we have been planning this since April, actually. It has been my contention, Doctor, that when we can lower the infection rate as a county, as a city, as a school district, and that starts to that's low enough that we need to attend to children's mental and emotional and social and academic health. It's time to start bringing children back to school. So what we had to do is we had to first offer to those parents who may have concerns, who may have family members with underlying health conditions, who may have children with underlying health conditions, we had to give them an option. And we did give them an option. That was to become a totally remote or virtual learner. So inside of that 7,200 students that we talked about 2,400 of them, or roughly 32%, are staying virtual. We're providing a laptop, a MiFi device if necessary. Teachers are interacting with them synchronously and asynchronously. In a way, it was helpful in reducing the number and helping social distancing. Because when you take 2,400 away from 7,200, you get a smaller school population that you have to social distance, that you have to make sure are following all the precautions. We made it a non-negotiable that if you wanted to come in, you would not only come in and be socially distant, but you would wear a face covering or face mask. That was a non-negotiable. And as you can see by your presence in the high school today, every student to date has followed that without question. Secondly, in all cases, we've reduced the number of students in classes and in hallways to what we called 50%, but really it's less than that because when you take out the virtual learners, geometrically the number goes down. So it was really important to do that to get off to a good start. And finally, we have students coming in 2 days, taking a day of with their teachers synchronously and asynchronously, and then bringing in a second group. Doctor, I tell you in the community, that's not where we want to live in education forever, but it's where we need to live now. And I'm hoping with all of this work that we're all doing, that quickly changes to get kids back into school where I believe they belong. In addition to that, we have cleaning protocols in place nightly. We have cleaning protocols in place during the day. And everybody has taken a collective responsibility to make it their ownership to keep their schools and their kids safe.
Yeah, that's awesome. Like you summarized so well that you are making sure that there is a safe social distancing in place in all the classes during the school hours, and there is ample disinfection and cleaning being properly done throughout your facilities. And hand sanitizer stations,
yes,
hand washing stations are available, yes, freely for all these kids. And all of them, they are wearing face masks. Yes, definitely. I have observed firsthand, like I have come across many students while I was walking in, and every kid was wearing a proper face covering, face mask, which is very essential. And thank you for teaching all these students, kids, and their families about all that. So moving on next, so you have a hybrid model of
yes,
teaching. So there are certain students who come for
yes,
in-person training, and other half is for other days. So it's 2 days a week for the students.
Correct.
And 1 day of cleaning, and 2 days for the second group of students.
That's correct. And Doctor, I don't know, medically we've heard a lot about herd immunity, and I know you know it better than anyone, but that takes a while to build. But we wanted to keep cohorts of kids together, familiarity with their routines, their classmates. Also in that formula, if a child does become ill, we will have 5 days. Say they become ill on a Tuesday, they're not scheduled to return to the following Monday. That gives us 5 days to really figure out with the health department, with the doctors, if there was something that was causing an illness in the child. It gave us some good distance. That decision came right out of our committee to reopen. I was of the opinion, let's go every other day. The committee thought that the 2-1-2 model was a better one, and we ascribed to that. The other thing that I'd like to point out, especially to a doctor and to the proud way I think we're running the district, is that every one of our 11 schools has what we've called an isolation room. In the isolation room is used only in the case that a teacher calls our nurse and says, I think that Joe is not feeling well. He's telling me he has a headache. He thinks he's got a fever, and he's feeling like he's nauseous. That student will immediately go to the isolation room. From there, the nurse will don full protective equipment, head to toe, and make an assessment while our associate is calling the parent to come in. Now, the beautiful thing about Niagara Falls Memorial Medical Center, and I'm sure you have a lot to do with this, is that if the parent doesn't have a primary care physician, and unfortunately some of our parents don't, or if a parent needs something quick, we have a hotline right to you. And I mean, I don't think you could find a school district in New York State that can say that. We have a hotline right to an infectious disease control doctor who will then give us guidance. And until that guidance is given, until the doctor and the test are negative, the student will be quarantined. Now, on the good side, they won't miss instruction. As long as they're up to doing things, they'll have their own personal laptop that the school has issued, and when they're up to it, they can take their lessons. The other part of that is that we go right to find out if you have siblings. So do you have siblings in other schools? Do you have siblings in the building? If that's the case, as a precaution doctor, we've been calling those siblings down. We've been talking to them, calling the parents, and we've been asking them to go home and to get further testing. I know it may seem to be a lot, but I think we have to come on strong and do those things to protect the community.
Awesome, yeah. So definitely, like if the kid is going to have symptoms, they are sent home. The school district have special rooms for those kids until they can be picked up. And the nurses here, they are properly trained. They wear all the PPE required while caring for that kid until the time this kid is sent back home to the parents or the guardians. And also, as the superintendent pointed out, that all the school students, the parents and guardians, they have access to testing through Niagara Falls Memorial. Like if you do not have any primary care doctor, you can call Niagara Falls Memorial and we will help you get the required testing. So that's awesome, Superintendent. So next moving is basically, so you have cohorts of different students. Right. So what about the teachers? Like, are there going to be mixing up of teachers, or they are same teachers instructing two different groups of students? How do you separate that?
Yeah, so the teachers are instructing two different groups of students. It is a heavy lift for our teachers. They're up to the challenge. They were partners in making this plan. Actually, I'm so pleased with our secondary teachers and the teachers at Niagara Falls High School, because what they were able to do, we had initially thought we would have certain in-person hybrid teachers and certain virtual teachers. But what the teachers at Niagara Falls High School decided was, we're cases that we need to, let's do both. This was them coming to the administration and saying, I'm teaching an AP government class, an advanced placement class. I don't want to lose that for the kids or the ability to teach that class. So my 4 other classes may be hybrid. That AP government class, I'm going to do it online and include all of the kids. So it's really been wonderful that the teachers have wanted to expand the curriculum much faster than I thought, because it really wasn't about curriculum in coming back. It was about safety, rituals, routines, mental health. But in a very quick way, and we're into really week 3 now, we have started to morph into some real higher level pedagogical questions, which I'm proud of, saying, how can I teach this? How can I reach more kids? How can I do this better? So yeah, our teachers have stepped up big time. The entire staff has, and we pray that continuing these protocols and procedures will be able to expand back to more than hybrid sooner rather than later.
Awesome. So next question I would like to ask Superintendent is basically the health screening. So most schools across state, they have some form of health screening for the students, for their staff members and visitors. So how it is done at the Niagara Falls School District?
Sure. Yeah, we do have a health screening, and every morning before any adult enters the building, they must take an 8 or 9 question survey or questionnaire asking about their personal health. They fill it out online. It goes to the principal and the nurse of the school. They review it immediately, most particularly if anyone has a fever or is caring for someone who's got COVID, or if they've traveled outside of New York State. We're very particular on those questions. If those are the cases, immediately some questioning goes back and forth between the nurse and the staff member in a confidential way. And then our doctor or nurse practitioner makes an assessment of whether it's safe to have that student that adult stay. Students are randomly sent those questions to their parents. So we're not doing it every day for every student, but in a random survey, we're sending out questions and asking parents to respond, maybe every day, every other day, every week. In addition to that, it is the responsibility of every parent and every staff member to take their own temperature. And I know you could be saying, well, that's a lot. No, it's what we expect from our staff and our teachers to keep everybody safe. We're all in this together, and just as masks protect others, you taking your temperature protects you and others. It's the one major parent involvement ask that we've had. To date, it has been very successful. Reports come back that kids are staying home because they're temped, and we go through the protocol of helping them there. Or if someone comes exhibiting signs or reports they don't feel well, the nurse takes their temperature, and we'll make a determination based on that. To date, and we are almost 2.5 weeks into school, we've had one temperature at 100, and that was an adult, and she was sent following the protocols. So I'm pretty pleased with that procedure. I'm satisfied that it's keeping us healthy, and those are the pre-screening things we do.
I'm glad that you are doing all those by the book, and again, as Superintendent pointed out, so this is our duty as parents. So if your child is not feeling good, not up to mark, so we have to keep them home. So this is for the safety of all of us in the community and to keep schools reopen. So please make sure that you go through the questionnaire which is sent to you through the school district, and if any of those questions are answered yes, please keep your child home, inform the school as required. So moving on, next is this meal programs. So these are very important for our children.
Very important.
And what steps have you taken at Niagara Falls School District to keep these meal programs going on?
Yeah, Doctor, the feeding kids is a priority. We have a low socioeconomic enrollment of students. We acknowledge that, we accept that, we appreciate that. But oftentimes for our students, our school meals are the best meal of the day for them. So since March 16th, we have provided meals 6 days a week for our community. And through September 1st, we have delivered over 500,000 meals,
wow,
breakfast and lunches, to our community. It's just a magnificent plan by our food service team. We do get governmental support to reimburse those meals, so it is coming out of your taxes, so to speak, but it's going to feed our community. Since we've returned to school, if you're in the hybrid model and you're coming to school, you pick up your lunch or breakfast and lunch during your normal time. If you're a remote or virtual learner, we have bag lunches available for anyone who is a child in the community between 11 and 1 at any of the schools. So you may not live close to Niagara Falls High School, but you live on Niagara Street, you can go there and get your bag lunch and breakfast. And we do that 5 days a week. On Friday, it's a double bag of meals for Friday and Saturday. And we've received a lot of thanks and positive praise for allowing that to happen in the community, because if you're not going to keep your health if you're not getting a nutritious meal. So it all goes hand in hand.
Yeah, so definitely meals are very important, and I thank you for keeping this program going, and I would request all the parents listening to this interview that please take advantage of this awesome opportunity kind of you have. So please feed your children during this pandemic, and thank you and all your staff for keeping this going on. So next question I have is the sports. So I heard that the governor has okayed going for certain low risk to medium risk sports on September 21st. So have you allowed any kind of sports, or what kind of sports have you allowed, and what precautions are you taking?
Yeah, so being a big sports person myself, I understand the you know, the importance of athletics, not just to have competition and have kids being active, but the socialization action of getting kids back into a normal routine, feeling like things are getting back on track, and being able to participate with friends. It's really important. We have subscribed to 4 sports. We're in the studio of our girls soccer coach that we're allowing: soccer, boys and girls, golf, tennis, girls tennis, and one final sport is cross country. Those are sports, with the exception of soccer, I would say, that are easily to social distance and wear a face covering. Obviously, golf is, you know, it's a solitary sport and you can stay separate. Cross country, you're running. Soccer gets a little bit more complex, but we're asking coaches to take all types of precautions. On Saturday, we had sports physicals. We had 80 children come in for sports physicals. Today, we have another 20. We did that through Niagara Falls Memorial Medical Center. Tony Serace and the team there came in and performed all of those physicals. So it's another link, another partnership with your hospital. Some students had other issues that had to be referred because of, and we're talking heart murmurs and other things like that. And now we're kicking off practices. October will be a busy month of sports. We'll review how it's going every day, every game. We'll stay in close contact with the kids. The coach's main job is to make sure safety is held and that kids are taken care of both physically and mentally first, and then to teach their sport, and then to have the spirit of competition. So I think it's good. It's the beginning of some normalcy, some routine, an outlet for kids. By canceling some other sports, such as football and swimming, and I should say, until the spring, we're giving kids even some opportunities to play a sport that they may not have done before, which is kind of a nice thing. It's kind of a nice thing. I know we're in the, as I said, the Coach Moranto is our soccer coach for girls, and he had a nice turnout of 30 girls for his teams. Maybe picking up a new student who has never played something. I think it's a good thing to not only play the sports, but to do it safely and to start to return.
Excellent. So yeah, definitely, like sports, as the superintendent pointed out, is a very essential part of overall development of our students. So please take advantage of these, play safely, and use all the precautions, which I have no doubt that school district is doing everything to keep you guys safe. Final question.
Sure.
So the cleaning and disinfection. So that is very essential, not just for COVID-19, but for preventing other infections. So have you trained your team how to do it? Did they go through any kind of special workshop, webinars? And how frequently you do, or your team cleans and disinfect, and is there any log kept of it?
Yeah, so cleaning and disinfecting is, as you said in your opening, one of the 5 or 6 pillars of this return. And it's the one area where we have added staff, Doctor. We've had to add staff to our cleaning team. We've put on and have hired 4 new people to clean. We've trained them. We have made 2 different shifts. So we have a Monday to Friday shift of cleaners, a Tuesday to Saturday shift. Why? Because on Wednesday and Saturday, there are no children in the buildings. We wanted the cleaners to be able to work in a real deep fashion, unimpeded, without having, to move around kids or go back to the lunchrooms on those days. So we made a split shift and added 4 members to the team with no students on Saturday and Wednesday. We've purchased the safest and best products that are recommended for cleaning. We've trained our staff. Everyone keeps a log of the areas they've cleaned: doorknobs, door handles, classrooms, tables, high-touch areas, some polycarbonate shields that we have, places where kids may just railings put their hands. We've done that with the addition of cleaners, some cleaners during the day. Not only the Monday to Friday, but the Tuesday to Saturday, and then the shift used to be 3 to 10, 2 to 10. Now they're coming in at 10 o'clock till 6 or 7 o'clock. So we've changed shifts, we've added shifts, we've added people, we've increased product, we've provided cleaning cloths and spray bottles for every classroom as part of the collective responsibility even students in this room need to take when they leave. I need to do that in my area. It would be impossible to out-hire the infection. We cannot out-hire this infection by having 1,000 cleaners. It just is impossible, both financially and physically. So everybody has to take some collective responsibility in their area, and that's what I mean. When I leave this table, I should have my wipe it down, put my face covering on and go. That's a reteaching tool that we all have to do, not only in our schools, but everywhere we go. So I'm really proud of the staff. They've been here, they've been safe. I hope they feel supportive. We've had labor management meetings to hear if we need additional supplies or one school isn't supported enough. We've had those conversations, and we'll try to do the best we can to give them everything that they need.
So thank you so much. Excuse me. So thank you so much, Superintendent. So this was a very good recap of the safe reopening for Niagara Falls School District, and hearing this from Superintendent give me a sense of confidence that I will feel safe to send my kid to the school district. And as he pointed out, that this is our collective responsibility. It's not just his or his staff's responsibility. We as parents have a lot of responsibility, and we should act on it. So I would like to thank the staff and all the administrators, principals, and families who are working or volunteering with you. Excuse me. So this is now opportunity for all of us, and we are in here together. And before I close, I would like to remind all of us certain things which we can do at our homes and to keep our communities safe. And these are the same things which we pointed out earlier. So if you are sick, please stay home. Wash your hands frequently. Water and soap are okay, like you have to wash it for 20 seconds if you are going to use it. Alcohol-based rubs are perfect for cleaning hands. Cover your cough with a tissue or inside of your elbow. Wear face masks when you are going to go out in public, and wear them properly. Like the face mask should be covering your nose and mouth, and it should be snugly fit. It should not be dangling around. So please use it, and especially if you are out in public. And the next thing which I would like to remind is immunizations. So all children should be up to date with their immunizations. Flu season is up, so we have to take our flu shots. So flu shots prevent flu. So as we know that the hospitals, so one of the minor indicators is how much are like in any given community, what is the percentage of utilized beds. So if somebody gets really sick with flu, they are going to take over that bed and increase the capacity of beds used in the hospital. So by taking those flu vaccines, we can possibly prevent those kind of hospitalizations. So again, I would like to thank you.
Oh, my pleasure.
It was awesome talking to you. If you have any questions for me or from the hospital, we are always available.
We're really blessed to have you and Niagara Falls Memorial Medical Center as our partner again. I can't say enough. It's a simple phone call and it gets done. That's what I appreciate the most. That's what the spirit of this community is. And you've been just a wonderful asset. We're glad you're here at this time or any time. Thank you, Doctor.
Thank you so much.